We've decided to, with Ibisa, the new institute, got brought to life because of a couple of things. One, we had a national plan for Aruba 2009-2018 focused on obesity and chronic diseases. Chronic diseases, non-transmittable chronic diseases are our major battlefield for us here. We were really looking at it from a life course approach, so from birth to death and what we need to do around that, and also an all of society approach. So as you've seen, we had to create a complete new institute. This is Ibisa, Institute for Healthy and Active Living. This institute will be focused specifically on our national plan and really implementing it. And this means healthy schools, food labeling, getting our people moving, getting the professionals and also our private sector helping us to move. We're seeing a big movement in this. We're seeing people actually being very active to really prevent chronic diseases, to help really break this rise in chronic diseases that we're seeing on the island. I think one of the most important things that it will also be doing is really incorporating the curative sector and care sector for the first time. And really what we're seeing is, if we look at dialysis, and we're seeing that our need for dialysis, the demand is growing beyond our capacity and also beyond what is healthy for a population of 120,000. The only thing we can do is, again, health promotion and prevention. And this is where we're talking about primary prevention, secondary and tertiary prevention. It's for people that are pre-hypertensive, people that are pre-diabetic. You have a specific line of attack. For people that are already diabetic or already hypertensive, that's your secondary prevention, so that they don't move up to dialysis patients, which is the end of the line. So really, we're focusing on this with everyone involved, and it's really taking the involvement of the private sector, the involvement of the tourist sector even. We've got the hotels involved with this also, and the whole population involved with all the different sectors. We're looking at the infrastructure that has been changed so that we change the environment around our people, and we're seeing that together with everything that we're doing, we've got many more people moving. We've went from a 9% mass movement to a 39% mass movement in a couple of years, which is phenomenal for Aruba. And I really have to congratulate our people for doing this. We are an example, not only in our region, but in our continent for doing this. And this is really the first steps that we're taking against the obesity, against the chronic diseases that we're having, and really protecting our next generation. And this is with the projects that we have in our kindergartens, healthy kindergartens, our healthy schools after that, and really promoting this, promoting the 60-minute-a-day physical activity, promoting healthy eating, and also teaching, giving the children and the people of the island the tools to live healthier and happier lives.